Hello friends, I am Dr. Vijay Kher, Chairman, Epitome Kidney and Urology Institute. Chronic kidney disease is increasing in epidemic proportions, and the main reason why there is this epidemic increase in the incidence of chronic kidney disease is because the high prevalence of diabetes and hypertension in our country. These diseases are also increasing to an equal proportion. 50 to 60% of chronic kidney disease is caused by diabetes and hypertension. It usually takes 10 to 15 years for diabetes and uncontrolled blood pressure to cause chronic kidney disease. So there is an ample opportunity for the patient as well as physicians to prevent or at least to decrease the incidence of diabetic kidney disease. Who are the people who are at high risk of development of diabetic kidney disease? Are people who have a family history of kidney disease due to diabetes. Families with heart disease, with high blood pressure, elderly people, people who smoke, or people who are obese and whose body weight is much higher than the usual proportions. So these are the people who are at high risk of development of kidney disease due to diabetes and hypertension. Only 30 to 40% of people with diabetes will develop kidney disease. 60 to 70% do not develop kidney disease. And these high risk people are the ones who are at greater risk of development of kidney disease because of diabetes and uncontrolled hypertension. How can we prevent the development of kidney disease in these people is by monitoring the blood sugar rigorously, and that can be done and monitored by observing hemoglobin A1C, which gives you an average of 3 months blood sugar to less than 7%, and also looking for albumin excretion in the urine by doing a spot urine albumin creatinine ratio. This is an early sign of kidney disease and kidney damage. So it's a damage marker and it can be assessed very easily. And one can also monitor kidney function by doing blood urea and creatinine in the blood and estimating the kidney function by estimating what is called glomerular filtration rate or EGFR. So if one monitors these frequently in diabetes and hypertension, so looking for hemoglobin A1C of less than 7%, controlling blood pressure to less than 130 and 80, and also monitoring for urine albumin excretion by looking at spot urine albumin creatinine ratio, and doing these tests 3 to 6 monthly in patients with high risk for kidney disease, which we emphasized are people who already have a family history of kidney disease, people who already have history of coronary artery disease or heart disease, or people with uncontrolled blood pressure, and those who smoke, who are obese, and whose blood sugars are not well controlled. So these are the people who are at high risk, and they should be doing these tests frequently. Control of blood pressure is extremely important for even preventing the kidney disease from progressing very rapidly. So it's very important to control blood pressure to less than 130 and 80 millimeters, and taking adequate amounts of fluids as well as keeping your salt intake to less than 4 grams a day would also ensure that the blood pressure doesn't rise and it remains well. And if the blood pressures are high, then controlling it with use of medicines, appropriate medicines as per the doctor's advice, would be very, very important for controlling or preventing kidney disease or even preventing progression of kidney disease. Wishing you Best to take care of your kidneys and preserve the health of the kidneys on the World Kidney Day, which falls on 14th of March 2024. Best wishes. Thank you.